What is crisis intervention for schizophrenia and PTSD? Have you ever wondered how to support someone experiencing a mental health crisis, especially when they are dealing with schizophrenia and post-traumatic stress disorder? Crisis intervention for these conditions is designed to provide immediate and focused support during acute episodes of distress. The main aim is to stabilize the individual, ensure their safety, and avoid hospitalization whenever possible. When someone with schizophrenia is in crisis, they may experience symptoms like hallucinations, delusions, or severe agitation. Effective intervention starts with acknowledging their experiences without reinforcing any delusions. For example, if a person hears voices, you can validate their feelings by saying you understand they are distressed, but you do not hear the voices. This helps redirect their focus to the present moment or a calming activity. In cases where delusions or paranoia arise, it is essential to approach the person with understanding, without arguing about their beliefs. Instead, offer practical help and focus on immediate safety needs. These techniques aim to reduce distress and prevent the situation from escalating. Now, let's talk about post-traumatic stress disorder. Individuals with PTSD may react intensely to reminders of their trauma, experiencing flashbacks or overwhelming anxiety. Crisis intervention here focuses on grounding techniques, emotional support, and reassurance that the crisis is temporary. Safety planning is also vital, along with connecting the individual to longer-term therapeutic resources. For those facing both schizophrenia and PTSD, an integrated approach is necessary. This means recognizing the overlapping symptoms and the increased vulnerability to stress. Individuals with both conditions may experience more severe symptoms during crises. Effective crisis intervention includes several key steps. First, assess any risk to the individual or others, including thoughts of self-harm. Use de-escalation techniques that consider both psychotic symptoms and trauma-related distress. Providing a calm and non-judgmental presence can help reduce fear and confusion. Engaging the person in a collaborative safety plan is also important. This plan should acknowledge triggers from both psychosis and trauma. Coordination with mental health professionals may be needed for medication adjustments or hospitalization if necessary. Connecting individuals to psychosocial supports, such as cognitive behavioral therapy and family interventions, can help manage symptoms over time. Crisis planning interventions can be particularly helpful. These plans are prepared ahead of time and include identifying early warning signs, preferred coping strategies, and contact information for support persons or crisis teams. Research shows that having a plan can reduce the risk of compulsory hospital admissions for people with schizophrenia. In summary, crisis intervention for schizophrenia and PTSD is about immediate stabilization through validation, de-escalation, and safety planning. It addresses the complex interaction of psychotic symptoms and trauma responses, aiming to minimize harm and support recovery during acute episodes.